I'm Rachel Werner. I'm professor of medicine and healthcare management, and I am executive director of the Leonard Davis Institute of Health Economics. I'm talking to you today about a study looking at Medicare payment reform, such as bundled payments, and how Medicare saves money in part by shifting those costs onto unpaid family caregivers. Alternative payment models have become a common way for Medicare to try and constrain healthcare spending. They do so in part by making providers accountable for the costs of care across an entire episode of care. So for example, when someone is hospitalized for a hip or a knee replacement, the provider is responsible not only for the costs of the hospitalization, but also the costs of rehabilitation after the hospital discharge. These payment reforms have been shown to decrease Medicare spending largely by decreasing inpatient rehabilitation after hospital discharge and shifting care instead to a home-based setting. I wondered how much of that care was being picked up by unpaid caregivers. No prior study has looked empirically at the effects of bundled payment or any payment reform on caregivers or even costs outside of Medicare. So this is the first example and the first rigorous evidence of the effect of these payment reforms on family caregivers. It's estimated there are about 38 million caregivers in the United States caring for older adults. There have been many good studies showing that informal caregiving like this comes at a high cost to the caregivers, including economic costs, emotional costs, and physical costs. Based on foregone wages alone, caregivers give up over $500 billion annually. In addition to those wage-based financial costs, there are emotional costs, there are costs to caregivers' physical well-being, and then there are financial non-wage-based costs, including foregone pension, retirement, and Social Security income. We looked at the need for and the receipt of caregiving after hip or knee replacement among a large group of Medicare beneficiaries. And we looked to see whether that changed when bundled payment was implemented in about 75 metropolitan areas across the United States, comparing it to over 100 metropolitan areas where the bundled payment initiative was not put in place. We found that while bundled payments save Medicare money, they do so in part on the backs of unpaid caregivers. Like many studies prior to this one, we found that when bundled payment initiatives were put in place, the use of inpatient rehabilitation after hospital discharge decreased, and the use of home-based care through home health agencies increased. What we found that was new was that the number of visits patients received from home health agencies declined, probably due to the financial pressures of being in a bundled payment initiative. And at the end of the home health episode, patients needed more help from caregivers, and caregivers provided more help than they did prior to the bundled payment initiative. We found about a 10 to 15% increase in the need for and the receipt of caregiving after the bundled payment initiative was put in place. The size of the effect that we find in this study is not enormous, but it is very important, in part because it's the first time someone has shown that there is an effect on unpaid caregivers. We look at just one alternative payment model, and these types of models are spreading, and they are currently make up at least half of the Medicare payment. In addition, there are capitated payment models through Medicare Advantage that constrain healthcare spending, and so we expect this type of spillover onto caregivers to be much more widespread than what we found in this study. In addition, we're seeing a big trend towards shifting care from institutional settings to home-based settings, not just after hip or knee replacement, but hospital at home, rehabilitation at home, other types of home-based settings, where the burden of care is really being shifted onto caregivers. So we expect that the effect that we showed here is really just the tip of the iceberg. These findings have important implications in several ways. First, I think it points to the need to evaluate payment reform models like this using a broader lens and taking into account not just Medicare costs, but societal costs, including the cost for caregivers. It also really points to the need to better support caregivers. There has been a number of pushes over the last decade or two to increase support for caregivers, and incorporating caregivers more formally into the care delivery team, including by paying them, would be a step in the right direction. I think there's one other policy implication that's important, which is that as we shift more and more care home, we need to think about expanding the home-based services that are available through Medicare. Right now, the home health care services that are available are limited in scope and length of time that they're available. But to adequately support people as they rehabilitate at home, we need a more comprehensive approach to home health care.